The cause of cancer can be explained as a result of three pathological processes. These are environmental and hereditary factors, genetic transformation, and immune system failure. Understanding these factors plays a major role in the prevention and treatment of cancers. Environmental and hereditary factors represent a local stress factor that initiate normal body cells to be transformed into cancer cells. Tobacco smoke is the most common carcinogen associated with cancers. Since the lung is the organ most exposed to this agent, this carcinogen often causes lung cancer. Other cancers associated with tobacco smoking include throat and stomach cancers. Other carcinogens include radiation, common sources of which are microwaves, cell phones, and X-ray machines. Asbestos, once heavily used in air conditioning and home insulation. Organic chemicals, and infectious agents such as viruses. Hereditary factors may also act like carcinogens and initiate cancers. This includes genetic abnormalities and inherited tendencies. For example, there exists an increased risk for ovarian cancer in the female child of a parent who had breast or colon cancer. However, this risk decreases with the generation gap. Knowledge of environmental and hereditary factors plays an important role in preventing cancers and assisting in early detection. Public health education is often provided to encourage avoidance of known carcinogens, or habits that increase the risk of cancers. These include anti-smoking campaigns, and the prohibition of use of asbestos in construction material. Persons with hereditary tendencies are usually advised by their doctors to have regular medical screening for potential cancers, as they may be associated with their inherited abnormalities. How hereditary tendencies and external factors affect genetic transformation in cells. This is a normal cell. The cell's function is governed by its nucleus. The nucleus is the control center of the cell, and contains special organic systems called genes. Genes hold the blueprint for how to develop the cell, how the cell divides, multiplies, and how the cell ultimately dies. This function is essential to your body's need to constantly repair its organs and replace worn or damaged parts. The underlying cause of cancer is damage to these genes. The genetic transformation or mutation produces such characteristics as increased growth tendencies and the ability to invade adjacent tissues, or metastasize to distant areas of the body. This genetic transformation is usually characterized in two ways. These are the formation of cancer-promoting genes, called oncogenes, that stimulates the cells. The removal of cancer suppressor genes, or the gene that prevents cancer characteristics in these cells. The formation of oncogenes. In normal cells, cell division is a tightly scripted process. The process is controlled by special genes called proto-oncogenes, found in the nucleus of the cells. These genes are responsible for stimulating and controlling cell division. Proto-oncogenes rely on special signaling molecules, seen here in red, called growth factors. These molecules stimulate the cell to divide. When all cell systems are working properly, cell division is not possible without this growth factor signaling mechanism. In abnormal cell nucleus, however, normal proto-oncogenes may be mutated by some external factor in the environment, such as cigarette smoke. The resulting mutant gene is called oncogene. Oncogenes contribute to cancer development by disrupting a cell's ability to regulate its own growth. Cells that carry highly expressed mutated oncogenes no longer respond, or need growth factor signaling to stimulate or regulate cell division. The resulting characteristic is a cell that divides uncontrollably. This situation is akin to a car that has its accelerator pedal stuck in the accelerate position. The removal of cancer suppressor genes. Here, we take a look at the cancer suppression mechanism or pathway. This system works to limit the probability that cancerous or mutated cells propagate. In the normal cell growth pathway, cells that have sustained damage to their DNA are either repaired or are destroyed under the management of tumor suppressor genes. Here we observe tumor suppressor genes. These are stimulated or produced inside the cell, in response to defects detected in the cell's DNA. High concentrations of tumor suppressor genes stop cell growth, or induce apoptosis. Apoptosis is the controlled destruction or death of the cell. The mechanism is therefore designed to eliminate the uncontrolled replication of cancerous cells. However, where there is a mutation, or genetic transformation in the tumor suppression gene itself, damaged cells fail to enter the destruction, or apoptic pathways. The result is that these mutated cells are allowed to multiply, and are not subjected to further DNA repair or apoptic attempts. This situation is similar to a car that has a faulty brake pedal engaged, while the vehicle continues to accelerate. We have just examined how exposure to external factors, such as cigarette smoke, or inherited traits may produce genetic transformation in the cells. Now we will consider how these factors lead to immune system failure. The immune system represents the largest defense mechanisms of the body. It is designed to remove infectious agents such as bacteria and cancer cells. The immune system can remove genetically transformed cells before they become florid, provided that it is in optimal condition. Here we observe a highly magnified movie of white blood cells, a key part of the immune system, chasing, and eventually engulfing bacteria. Immune system failures may result from various medical disorders such as HIV infection, which will increase the incidence and severity of cancers such as Kaposi sarcoma in these persons. As we saw earlier, mutation inside the cancer suppression gene itself renders the cell incapable of stopping the growth of cancer cells. It is the fundamental nature of this failure that presents the immune system with a distinct disadvantage in protecting the body against cancer cells. It is therefore imperative that all aspects of the immune system are fully functional, if cancer is to be eradicated from the body. The use of various modalities of cancer treatment such as chemotherapy, radiotherapy, and surgery. These treatments are attempts to reduce the cancer mass. This decreases the workload on the immune system, and increases its chances of eradicating the cancer. Unfortunately, many of these treatments may also adversely affect the immune system, thus reducing its ability to destroy the cancer. Here we observe the resurgence of the cancer.